Are you wondering which eye is your dominant eye? I'm going to show you 3 different ways that I use in the clinic all the time, but you can do this at home to see if you're left eye or right eye dominant. Let's focus in. Hey, howdy everybody, this is Dr. Neil Gaiman, Dr. Eye Guy, with the channel that keeps your eyes healthy and your vision clear. Now, knowing which eye your dominant eye is can actually be pretty important for many different things. For example, sports, baseball, golf, shooting, archery, or for photography, or as an eye doctor, knowing for our patients which eye their dominant eye is can be pretty important. The first test, and this is probably one of the most common ones that you'll see, is called the Miles test. Now for this test, you're going to want to focus on a distant object. Now this can be a light switch, a doorknob, a like button, or a light bulb. For this video, I'm going to use this light bulb for the distant object. And to get ready, you're going to make a small little opening with your hands, almost a triangle shaped opening in your hands. And you want to make it just big enough to fit that distant object that you're going to look at. Make sure it's not too big so you can look through it with both eyes. You want it small enough just to fit that distant object. Now you're going to look at and focus on that distant object. Make sure both eyes are open and make sure you don't move your head side to side. And now naturally and pretty quickly you want to line up that distant object into the small opening that you've made with your hands. Now once you have it lined up in that opening, you're going to close one eye. For example, I'm going to close my left eye, and if that object is still in the opening in your hands, then you're looking through your dominant eye. If you close an eye and all of a sudden that object is either behind your hands or off to the side, it's not in the opening, then you're looking through your non-dominant eye. Now there's also another way to do this if you can't close one eye. You're going to still look at the distant object with both eyes open, line up the object in the opening, and then you're going to slowly bring your hands closer to your eyes. Keep that target within that opening the whole time. And eventually once you get close enough, you'll get to your dominant eye. Test number 2 is called the Porta Test, or you can think of it as the pointing test. This is very similar to the Miles test. You're going to pick a distant object, looking at it with both eyes open, corrected for the distance, and you're going to point at that object. Now when you point at the object, you actually want to cover that object with your finger, or you can also use your thumb, but make sure that your finger is covering the object. Now this one might be a little bit tricky because when you're actually pointing at the object, you're going to notice 2 faint images of your finger or your thumb. So when you actually point at the object, you want to do this naturally and kind of quickly. You want to cover that object with one of those faint images. Now you want to do the same thing you did before. You want to close one eye, and if that object is still behind your finger or your thumb, then you're looking through your dominant eye. If you cover an eye and notice that your finger is not covering the object anymore, it's off to the side, then you're looking through your non-dominant eye. And also similar to the first test, if you can't close one eye, then you can slowly bring your finger closer to your eye, keeping that object behind your finger, and eventually you will be pointing at your dominant eye. Now before we get to test 3, I'm definitely curious, comment below if you've done these tests, which eye is your dominant eye? I'm guessing most people are going to say they're right eye dominant. Now this third test is also pretty common, but it might be a little bit trickier to do at home, but I'm still going to show you a way to do it. This test is called the lens blur test or the plus magnification test. And just like the first 2 tests, you want both eyes using their distance vision correction. So if you wear glasses for distance, you want to be wearing your distance glasses. And just like the other tests, you're going to be looking at a distant object and you're going to hold a plus magnification lens over one eye and then the other one. Now here's what you're looking for in this one. The eye that is more significantly visually affected is your dominant eye. For example, I'm right-eye dominant, and when I put this lens over my right eye, I notice that my vision is definitely more blurry. It's way more uncomfortable than when I have it over my left eye. When I have it over my left eye, it's still blurry, but I still can manage. It still seems clear, less uncomfortable than when it's over my right eye because I'm right-eye dominant. Now you can also do this at home if you happen to have a pair of readers or cheaters that you can get from the store. Now the power that you want to look for is a plus 1.5 or a plus 2. That's usually commonly what we use in the clinic. But if you don't have those readers, then you can also do this at the store. So the next time you're in Walmart or Walgreens, definitely head for the cheaters section and pick a 1.5 or a plus 2 off of the rack. Now remember, you want to be wearing your distance glasses, your distance correction when you're doing this test. And you can do this right in the store. If you just pick a distant object, you're going to just use one side of those cheaters, one lens, and cover one eye at a time. And then just remember, whichever eye is more significantly affected, maybe your vision's more blurry when you do it on that eye, it's more uncomfortable, that is your dominant eye, because your dominant eye doesn't want to be messed with. Now, just a few tidbits about eye dominance. Now, there are actually a few different types of eye dominance that we can go over. One is called motor dominance, or whichever eye is less likely to lose concentration or lose the target when something's moving. That eye is going to be your more motor dominant eye. And along with that, you can have a sighting dominance, whichever eye is going to be your sighting dominant eye. When you want to lock onto a target really fast, that's going to be your sighting dominant eye. And another one could be sensory dominance. If you have one eye that sees better than the other eye, maybe is stronger or has less of a prescription, that can be your sensory dominant eye. Now, usually one eye is your dominant eye that covers all those different traits. It could be the motor, sighting, sensory dominant eye, but it is possible to have a mixed dominance. You might have one eye that could be your sensory dominant eye, but then your other eye could be your sighting eye, and so you'll have a mixed dominance there. Also, along the same lines of thinking, usually if you're right-handed, you're going to be right eye dominant. If you're left-handed, you're going to be left eye dominant, but that could be crossed. Some people can be right-handed and then be left eye dominant. That's called cross dominance. It's also possible, kind of rare, to not have a dominant eye, which could be pretty nice depending on the situation. Also, something to be aware of is some people might have their eye dominance change depending on the situation or depending on the scenario. For example, most people are right eye dominant, but depending on the scenario, like lighting conditions, or if you're looking at a distant object compared to a near object, it might switch over to the left eye being the dominant eye. So I definitely recommend testing your eyes multiple times. Use all three different tests, use different scenarios. Maybe you look at a far distant object and maybe an intermediate object, different lighting conditions, just to see if your eye dominance is different depending on the condition. Now remember, if you're looking for more eye-related tips, definitely check out my videos right there. Also consider subscribing. I'm Dr. Neil Gaiman, Dr. Eye Guy. Stay focused.